You've been diagnosed with an enlarged prostate, and even though you're experiencing several prostate symptoms, you don't want to take medication and are searching for another natural way to handle this condition. Welcome. I'm Dr. Girag Mihai, and in today's video, I'll explain how to treat benign prostatic hyperplasia, or BPH, without relying on drugs. Before we go further, pause for a second. Hit subscribe and turn on the notification bell so you never miss new science-based ways to protect your prostate and your overall male health. Although this problem mostly affects men over the age of 60, for you, the younger viewer, this information will also be extremely useful since it can help you begin prostate prevention early. Because like it or not, most men will eventually deal with an enlarged prostate. But in many cases, it won't produce noticeable inflammation or discomfort. When it's finally diagnosed and symptoms appear, doctors usually recommend surgery or medication. However, many men prefer to avoid those routes, either because of fear or because they want to stay away from the side effects that sometimes affect male health and daily life. So now that we understand this, let's start with the practical advice. The first step is simple. Start increasing your hydration by drinking at least 1.5 to 2 liters of water per day. It doesn't have to be special mineral water. Ordinary clean water is enough. What truly matters is starting early in the morning and continuing gradually throughout the day, either by taking small sips or full glasses. But make sure not to drink beyond 5 p.m., since doing so can increase nighttime. In case you didn't know, most BPH symptoms relate to urination problems, like needing to pee frequently or feeling as if your bladder emptying isn't complete, which forces you to go again and again. Over time, that constant strain adds to bladder inflammation and worsens symptoms. By keeping yourself well hydrated during the day, you help reduce inflammation, improve blood flow to your kidneys, and naturally ease your symptoms. The second tip connects closely to the first. Avoid drinking liquids after 5 p.m. This might sound simple, but it's one of the most important changes you can make, and believe me, most men overlook it. When you keep drinking water or other fluids after that time, you'll increase your urination frequency at night, disrupting your sleep and making your swollen prostate symptoms more persistent. Once you apply these small adjustments, you'll begin to notice a real difference in how you feel. Try them, and later let me know in the comments how it worked for you. If you haven't yet, let me mention that at the end of this video, I'll share 4 home remedies that can greatly help reduce prostate inflammation. So stay tuned until the end. If you're ready to start taking simple actions that truly help your prostate, type "flow" in the comments. Let's see how many men are taking charge of their flow today. Now, back to the next step. Now, the third piece of advice: start reducing your caffeine intake throughout the day. Caffeine acts as a bladder irritant, and it also stimulates the prostate, which can worsen your urinary frequency and discomfort. You can find caffeine in coffee, sodas, certain teas, and energy drinks. So if you're someone who drinks coffee every morning, I recommend switching to decaffeinated coffee, and try not to sweeten it with regular sugar. Use natural sweeteners instead. Of course, your total caffeine intake should not go beyond 200 milligrams of coffee per day, which equals roughly 2 cups. The fourth recommendation concerns your consumption of alcoholic beverages, particularly beer. For instance, if you go out with friends on the weekend and drink 10 or 20 beers, you might soon develop urination problems, like difficulty passing urine or a swollen bladder that feels blocked. Eventually, this situation can become so severe that you may need to visit the emergency room because the pain is intense, your bladder is distended, and you simply can't urinate. In such cases, a catheter has to be inserted to release the urine, an extremely uncomfortable experience. So, to avoid ever needing such treatment, it's best to start reducing how much you drink. Now, a quick check-in. Are these lifestyle insights helpful so far? Type 1 if yes, or 0 if you'd like me to cover other prostate topics next. Your feedback guides future videos. The fifth piece of advice is to increase your intake of fiber-rich foods such as fruits with skin, green leafy vegetables, lentils, beans, and nuts. Doing this improves bowel regularity and helps prevent constipation. Research shows that in people who suffer from constipation, the expanded colon presses on an already inflamed prostate and the bladder, worsening symptoms over time and accelerating disease progression. Therefore, if you're having digestive or intestinal issues, make sure to address them too. It's an important step toward improving your prostate health. The sixth suggestion is to practice the double voiding technique, which helps ensure you completely empty your bladder. It's very simple. Once you finish urinating, stay in position and wait for 30 seconds to a minute to see if more urine flows out naturally. Don't push or strain, just wait. This method helps reduce leftover urine, preventing urinary tract infections that often accompany prostate enlargement. The seventh tip relates to something you've probably heard before: the difference between urinating while sitting or standing. Studies show that sitting to urinate offers two main benefits. First, it allows you to empty your bladder more fully without much effort. Second, it promotes better hygiene, especially in shared living spaces. While there's no solid evidence that sitting reduces the actual size of the prostate, research confirms that it improves bladder emptying, which eases symptoms. Interestingly, it's been scientifically proven that men who start sitting to urinate from a younger age significantly reduce their likelihood of suffering from benign prostatic hyperplasia later in life, or at least they experience fewer symptoms. If you've watched the video until now because you enjoy learning the full information, or maybe you skipped ahead, here's your reward: the best natural remedies you can start using today to calm your inflamed prostate. The first is saw palmetto extract, known for its anti-estrogenic properties. Many standard BPH medications are derived from this same plant. The second is tomato juice, packed with vitamin C, folic acid, and iron, all powerful nutrients that help fight prostate inflammation. Another effective group of compounds are flavonoids, which decrease inflammation of the gland and help regulate testosterone levels naturally. And don't forget pumpkin seeds. Their anti-inflammatory and antioxidant properties not only support natural prostate care, but also help in prostate cancer prevention. Before you go, subscribe and turn on notifications so you don't miss honest, practical men's health videos that could save you from surgery later. Tell me which tip helped you most, or what you've personally tried. Your stories inspire me to keep creating free health content. And please share this video with friends or family men, because simple habits like these can keep them healthy for years to come. Gentlemen, if today's video helped you protect your health,
your confidence, or your energy, you can now say thanks in a special way. Just click the thanks button below the video. Your support helps me share more tips that keep men strong and healthy well past 60, and I truly appreciate every single one of you.